July 7th, 2021. The World Health Organization also recently highlighting the Lambda variant a year ago in Peru.
Definitely some fear mongering going out there to manipulate the public by suggesting the variants are going to be, come back with a vengeance.
Dr. Marty McCary is a professor of surgery and health policy at the Johns Hopkins School of Medicine and author of The Price We Pay.
The reality is every COVID infection is with a variant. Variants constitute every virus that's out there right now. We don't have the original strain still circulating, and because it's a variant just means it may be more contagious. So the risk, so you can feel good if you've got vaccinated about these new variants like the Delta variant and Lambda variant. You shouldn't worry about them. If you've got natural immunity, for sure, you don't need to worry about these new variants. If you're unvaccinated, it means you're more likely to get it because it's more contagious, but the background level of infection is so low, that's a factor in your likelihood of getting it. Right now, we've got about 1/20th the number of cases on a daily basis as we did just 6 months ago. So there's not as much virus in society right now. So the Delta variant is about 40% more transmissible, more contagious. You can think of it as more sticky. And so it's not going to somehow find you if you're at home by yourself and seep through the vent. But it does mean if you have a brief interaction with somebody indoors, the likelihood of getting it from somebody infected is going to be a little higher. The folks that should be aware of this are those who are what we call susceptible or non-immune. Now, at the same time, there's no evidence that either the Delta variant or Lambda variant or Alpha or any of the variants have been more deadly. Comorbid condition like obesity who are still susceptible, that is, they're non-immune. Kids still remain a very inefficient transmitter of the infection, and when they get the infection, they tend to get a much lower grade infection. The rate today is 2 per million. That's the population incidence of a child being hospitalized for COVID among children the last year and a half. I get all kinds of different answers. Total number of kids under 18 who have died from COVID for the whole pandemic, 326 as reported by the CDC, but that could have been causal or incidental. That is, COVID could have just been simply tested for when they came to the hospital for a broken arm, or it could have been the reason that they came to the hospital. I'm not suggesting we blow it off, but when parents are trying to make a calculation on the vaccine, for example, in a 13-year-old, a couple principles. Number one, if the kid is healthy, it's very hard for this virus to hurt them. If the kid has a chronic condition, like the kid is obese, those are the kids that have much worse skewed outcomes because there have been a cluster of heart complications with the second dose.
It's not a proven link at this point.
If there was a risk to their health, then I would say maybe that makes sense. The issue is that for a healthy kid, as we've always said, and as the data have now affirmed, it's very hard for COVID to hurt a person young and healthy. The risk is then that they could transmit it, even unknowingly, to somebody who is high risk, because there's a different level of background risk in the community, depending on the community. Some communities in the United States have almost no COVID. There's almost no COVID in the schools and in the young groups. Other communities have had outbreaks in sporting events with teenagers, and we need to respond quickly when there's an outbreak and take significant mitigation. 500 kids a year die from the common cold, a virus called RSV. So it's always good to practice good hygiene, but at the same time, the perception of risk, I think, is distorted.